Hello everyone. Today we'll be talking about diaphragmatic hernia. Diaphragmatic hernia happens when there is a hole or a defect in the diaphragm. And when this happens, it allows the abdominal contents to go up in the chest cavity and the thorax. And when you have other contents in the chest cavity, there is a smaller or narrower space for lungs to expand, and that's why we have pulmonary hypoplasia or dysplasia in this case. There are two major types of diaphragmatic hernia. It's either congenital or acquired. Acquired in cases of trauma, iatrogenic after surgeries, or hiatal hernia. But in cases of congenital, you have buctalic hernia, which is the anterolateral, and it's way more common. It's the most common form because it's easier for the intestines to invade the left side than it's to the right, because on the right we have the liver, it's way stronger. And there is the second type of the congenital diaphragmatic hernia, which is more gagny. It's the anterolateral, and it is less common. So what is the clinical presentation of these babies? They present with cyanosis, respiratory distress. You have sunken abdomen because the contents are already in the chest. The abdomen will be sunken inside, and you sometimes auscultate bowel sounds in the chest cavity. How to diagnose it? It's sometimes or most of the time diagnosed prenatally by the ultrasound, and sometimes if the case is mild, you diagnose it after birth with chest x-rays. What to do if you have a baby that will be born and she or he has diaphragmatic hernia? The biggest mistake is to ventilate these babies with bag masks, because in this case you will be worsening it. So intubate them fastly, provide oxygen, and insert an orogastric or nasogastric tube to just decompress the pressure there. The cure is definitely surgery, but what we want to do is stabilize the patient until they can go into surgery and avoid the complication of lung diseases, bronchopulmonary dysplasia, and the hypoxia that may cause neurodevelopmental delay.